And in that moment, that student learned right away how to pull a lever that she couldn't do at the time. And so her telling that story, getting emotional, telling about what she learned from it, most importantly, and how she would do it differently in the future. I mean, you see a student go through that, even if they're young, I'll hire that person any day.
Right, so welcome today, folks. We're so excited to have on with us Keith Hustak. He is the Vice President of APP Services and Operations at Spectrum Health Medical Group. So welcome to the show today, Keith.
Thank you for having me. Excited to be here.
Great. So I'd love to start out with chatting with you about, your own journey in becoming a PA. And I'd love you to tell me a little bit about, when that started and how kind of that journey unfolded for you.
Yeah, I always tell people that I was pretty much groomed to be in healthcare. My dad was a psychologist and owned his own practice. And so we grew up, my brother, by the way, is a physician. We grew up hanging out in the office at night while my mom was, typing up the charts, and my dad was still seeing patients. So we were kind of groomed to go into healthcare. Why I chose PA basically came down to this. I was considering physician. I was considering athletic training at the time, but I got a summer job at a Orthopedic Institute of Ohio. It's in Lima, Ohio. And I met a gentleman there named Jeb Scheidler. So if Jeb is watching, hello, Jeb. And I didn't know what a PA was. Had no idea, never heard of the term. And he said, I know you're thinking about athletic training, maybe physician, but man, you got to check out this PA thing. It's just, good salary, better hours, a lot of autonomy. And that really, I liked everything that he said. And so next thing I know, I was like in the OR, kind of shadowing. I didn't pass out, and I thought, man, this probably is right for me. So that's kind of how it came to be that I would become a PA. And he, Jeb was the associate professor at Wayne State University in Detroit, Michigan. And so obviously I worked with him for 2 summers. And so, sometimes you have a leg in. He was able to help me, write a good reference letter for me. And that's how my journey started.
I was going to say, what was your family saying? It sounds like you had a couple of different things in mind when you chose the PA track. What were their thoughts?
Yeah, so I mean, very transparently, I think that they were proud that I was staying in the medical profession. I think they were still leery about this physician assistant thing. Again, this is back in, I'm going to date myself, but this is like back in the late 90s when I had those summer jobs that my dad set up for me. I think my dad, I think ultimately he was probably hoping I would become like a physician, but I think when I explained it to him, what I wanted to do and why I wanted to do it, have a little more balance, work-life balance, and have still that making an impact, but not be the sole answer. And I really like the whole team-based care concept, which back then we didn't really call it team-based care, but it's what's evolved. I think then that they understood and they were supportive of it.
Fantastic. Love that story. Was there any other moment? I know you said that you had a couple of folks that were influential in help you make your decision, but it sounds like pretty smooth. Were there any kind of bumps along the road or moment where you were like, is this the right thing to do?
Yeah, good question. I think the bumps came when I started realizing what it was going to take to get into PA school. At the time it was like, you go into medical school and it's really hard to get in. And then, you just kind of automatically think, okay, it must be easier to get into PA school. That's not true. Like it's, in fact, now I would say, what we're seeing and reading, I do a lot of work in my leadership role, partnering with schools. And what we're hearing now, it's almost at times harder to get into PA school. And it's just simply because of the volume of applicants that come in has really raised the bar even higher than what it already was. So I think that was the bump in the road, was realizing what my grades had to be in order to get into PA school. So many times, as you do your 4-year degree and whatever, for me, it was athletic training. And I had to go back to school for an extra year to do my prereqs, some of which I didn't get, I got like B's, B plus, right? I needed A's to get in. So I think that was the bump in the road, was realizing, okay, this is not like a get rich quick scheme. This is not going to be easy. I've got to really put my nose to the grind and increase my chances of getting in, which I did. And, I'm glad I went through it. And I think a lot of pre-PA students out there are probably going through the exact same thing. And that is retaking classes, making sure your core grades are up. And I certainly had a lot of that.
Absolutely. So why do you think it's, obviously the profession's grown so much over the last, 20 to 30 years. Why do you think it's so attractive at this point for students? And there's such great competition out there right now to get into schools.
Yeah, we talk about this all the time. So in my leadership role, and partnering with these schools, and we have such high demand, to your point. We had at Spectrum a 2-year waiting list, basically. So if you got into school, right, and then you wanted to do your clinical rotations, 2 years it took you to get through our system, because we had no preceptors for as many students as we have coming in. There's been this explosion of not only PA schools, but nurse practitioner schools. And the nurse practitioner schools are online. And that creates like a lot of access for students to go to school. But then we don't have the down the road supply of preceptors. So I think what attracts people, though, is the fact that, it's 2-year master's degree. It's a well-respected profession. You have a lot of autonomy to do some really cool things, procedures and diagnosing, prescribing medications, seeing complex patients. These days you can see patients virtually. I mean, there's so much you can do with it. On the PA side, you can go from one specialty to another, which is very attractive. I know there's a lot of PAs right now who are thinking, okay, I can go become a physician, right? I can go into debt, ton of debt. Maybe I'll have a little more autonomy in practice, or I can do PA route, which is less debt, still make a good salary, maybe better work-life balance. And if I get burned out, which is a hot topic right now in provider world, I can move from one specialty to another. I mean, when you think about those factors, it's like, it's no wonder it's been like, either 1, 2, or 3 on the Forbes best job list. I mean, it makes sense.
100%. And, you hit on a great topic. And so we're going to have you back another time, because, talking about switching specialties or even leaving clinical roles is like a whole nother feast of topics and things that we could discuss. So fantastic. Yeah. Let's move into the process. And this being a leader and someone who's hired, a ton of APPs and have overseen that process. Take me through your process from how you get resumes, how you make decisions on who to interview, and talk me through a little bit of your unique, vetting and interview process.
Yeah. So I'm going to kind of paint this picture. I want you to understand that I'm in a health system. I'm not like in a small practice or maybe even a multi-practice. Like, I'm in a large health system, 12 hospitals, how many, we have like 18 integrated care campuses. We just merged with Beaumont on the east side of the state. We are now like the 2nd or 3rd largest health system in the country right now. So that's my perspective. And
frame of reference.
What I mean by that is the way that we do it is we have a centralized recruiting team. And that recruiting team will help us kind of put in what we call requisitions for hire. And then that leads to a job posting, and then we get resumes. The recruiting team basically is the first pass through of all the resumes. Now, to put some numbers behind this, pre-pandemic, we were seeing 80 applicants, 80 for every one primary care job. So think about that right now. That's how popular and how maybe flooded our market is in Michigan. Having said that, that's a lot of applications to go through, a lot of resumes to go through. So our recruiting team basically does that first kind of pass through. Then at that point, they would then give it to either myself, if I'm the hiring leader, or now I have directors who are actually the hiring leaders. they're really tasked with reviewing the resumes. And I know this sounds like so simple and cliche, but just little things like, you can't have any errors on I know it sounds so like, how could this, it's 2022, how can this happen still? But it does. And when that happens, we just know that you have one job to do, and that is to make your resume perfect. And if you can't pay attention to that detail, I don't want you then taking care of my mother when it's 2 a.m. and she has chest pain, right? Those are just the things that we kind of think about. So you got to be really perfect, impeccable on your resume and your cover letter, that sort of thing. Then it comes down to an interview. So if you pass that phase of it, then we interview. Usually like to interview at least 2 or 3 candidates per role. And that interview process usually is a panel interview and then a one-on-one interview. On top of that, though, what we're starting to do is a lot of, and I think this would be interesting for your audience, a lot of kind of pseudo job interviews where we actually have the panel interview in the morning. We have the potential student come in and kind of interact with the team throughout the day, like sit in the team room, do rounds with them, go to lunch with them. And then they have like more of a one-on-one kind of interview at the end of the day. Now, during pandemic, this had to slow down because we didn't want that interaction anymore. But now that we're hopefully coming out of pandemic, we really want that to start happening again, because it's those little things when you get to spend some time with somebody for an hour or two. They let their guard down, we let our guard down, right? And you learn so much in those interactions versus an interview and just a strict, like kind of old school process of interviewing. If you read, there's a book about Google and how they do interviews, and they talk about how worthless interviews are. I know this is maybe different than what you have heard from others, but I like taking different approaches. And so that is one approach that I think we're going to start doing more and more of, is really getting into making sure that you're like comfortable with that team, and it takes hours to do that.
Sure, the whole shadow experience, very worthwhile. So tell me a story. I'm sure as you were kind of recounting this, you were thinking of, maybe some good stories and bad stories, but tell me a story about someone who you invited in for that day. You have that panel, you move into the shadow, and by the one-on-one, like everyone's, maybe thinking this is not going to work out. Tell me about that.
Yeah. So the one story that pops to mind immediately was really kind of our fault in the beginning, but then secondarily, it was the candidate's fault also. So this person had, great resume, right? Great resume. In fact,
no mistakes.
No mistake. The person had a ton of experience, right? And was coming to us from the east side of the state. And so we were pretty excited about this potential candidate. Interviewed well in the first panel interview, then started spending some time throughout the day. And again, as the day goes on, your guard kind of lets down. And then she just really got loose with her language and her professionalism. And then the ultimate kind of comment was she almost was complaining immediately about the call days. Part of it was our fault, though, because we didn't have the exact, it was very unclear on our job description how many call days it would be, but she was coming to this interview and almost immediately complaining about, you mean we have to call, this many times in a month, and it was like, for a busy orthopedic practice, those are the things that are just huge red flags, because if she's complaining about it before even getting into the role, it's just not the right fit. It's all about fit. It's nothing against her. It's just all about the right fit.
What's everybody saying at that point when she's, questioning call and
well, I mean, being a provider, call is a burden. I mean, let's all agree to that, right? It's something that it's part of the job. We're here for our patients. We got to provide access, but it's a burden on people. And call is a very sensitive topic for providers, right? I mean, it's like, that's probably one of the first things you want to understand is how many nights, how many weekends are you doing call? And you got to really kind of come to grips with that about your role, this role you're entering into. Same thing for the team. They're going to be trusting you with their patients and taking call. And so during that, when that discussion was going on, you could just kind of see the eyes in the room kind of raise and kind of look at each other. And it's like, we are, okay, we know this is not the right candidate. And good, luckily, this particular person moved on from that role, ended up getting a different role, which really suited her needs, right? And then the team hired somebody else. So it ended up working out. It's just, those are things that maybe could have been avoided with a little more dialogue even before, that step.
Well, thank you for that insight on what's going. Sometimes, when you're interviewing, I think people are so self-focused. It's great to hear, well, what were the people on the other side? How is what I was saying or doing or acting perceived? So that's big. So tell me a story of someone who came in and really did it right and made everyone feel really excited about their candidacy.
Yeah. Man, I can think of a couple stories. I'll go to there was a cardiovascular APP who we brought in. This particular person had been from Grand Rapids, so that's where Spectrum is, Grand Rapids, Michigan, west side of the state. Went down to school in South Carolina, tried to come back to do rotations with us. But I told you earlier how hard it is to get rotations with us right now. So that was just impossible. We have a strategy actually that we keep we have partnered schools, and we keep our students kind of within those partnered schools. So we have a rule, we don't allow like a South Carolina student to come up, even if she's from Grand Rapids. She can't come up and do rotations with us. We just can't do that. There's just so much backlog of students. In any case, goes down to South Carolina, tries to do rotations with us. She sought me out. She found out I was like the leader of, sought me out, and I think she came to Grand Rapids. We had lunch together. I kind of understood like what she wanted to do. Had, disappointing news that she couldn't do rotations with us. But I said, hey, when you graduate, just reach back out to us. And if you see something, just ping me. And sure enough, she sent me an email on Christmas. She sent me an email on Easter. She was like building up because she really wanted to be back in Grand Rapids and really wanted to be in the CV unit. I'm not saying that every candidate should do this, but I'm just telling you, think about that person for a second who is that in tune and is seeking me out because she has nothing to lose, right? Is seeking me out because she wants to be in Grand Rapids in the CV department.
I was going to say, what you have a candidate that's going through that. What does that feel like on your end to have that happen?
Oh, I'm elated. I mean, if someone is that excited about a role, immediately then what I do is I ping then the hiring manager. So our director said, hey, I had this great candidate. I met with her last summer. She's from the area, which we like, right? You want to make sure you understand why they want to be in Grand Rapids. She's from the area. She speaks very well. She has great background. I think her family was in medicine already. So it just really checks all those high, this is like a home run, right? Interviewed well, the let your guard down type scenario. She did great there, and we hired her, and she's still with us. She's doing a great job for us. So that's the ultimate for us.
I love it. We hit already a couple what I call those red and green flags, and I do want to discuss those a little bit more, but I want to spend a little bit more time on the interview process and talk a little bit about some of the questions that you like to kind of go over with new grads, and then maybe we'll chat even about your toughest question that people could prepare for, because I think students want to, they want to know what to expect, and a lot of their questions are around, well, what am I going to be asked, and how can I be preparing best to do a great job?
Yeah, it's interesting at Spectrum. I talked about how we have kind of everything in a centralized process already. So we have certain questions that are kind of like the blanket questions that we have to ask. And we ask these for consistency, for being standard, that sort of thing. But having said that, I always like to ask extra questions because I think it gives me more insight. The biggest one I love to ask is a failure question. Name one time that you failed and why did you fail? What'd you learn from it? And it's amazing that question still trips people up. When they can't think of a time they failed, that concerns me. Either that they're not aware that they failed at something, or that they're just not wanting to tell you. And I think as a provider, you have to know, especially as an APP or a PA, you have to know kind of your guardrails of when you might get in trouble clinically and when you might not get in trouble. So if they can't recognize when something's going wrong, I think we got huge red flags there. So I would encourage everybody out there to start thinking about a time that you failed and embrace it. Embrace your failure. Because let me tell you, as a PA, you're going to fail a lot. And how you handle that failure probably is going to determine your career. I've seen many careers ruined where someone didn't handle failure right. So you have to be able to understand that. A lot of young kids coming out of school, they don't handle that question well. So that just tells me maybe their maturity isn't there yet. Maybe they're not really had much failure. And I would rather have someone who has failure.
Yeah. So great. So we're talking about the failure question and how to answer that and what you're looking for. But give me an example of how someone could answer that question. What does that look like?
Yeah, the first part is being honest about the failure itself. But then secondly, the key is the second part of the question is, what did you learn from it? What did you do as a result?
So talk me through an example. Talk me through a response that someone might give you that you're like, you hit it out of the park.
Sure. I'll try and give you a real life example. I don't remember the specialty. This one's been a number of years ago, but the particular person, this is during PA school. The particular person was working at a pediatric kind of clinic, essentially. And I think when you have pediatrics, you have the dynamics of the child and then the parents, right? It's those kind of dynamics. This particular preceptor, it seemed that they gave a lot of autonomy to their students who rotated through. It was a very busy practice, that sort of thing. And this particular PA kind of made a mistake in terms of diagnosis, but on top of that, maybe the communication of that mistake to the parents wasn't the greatest. And so when she came in for an interview, it was centered around, and when she was describing this journey that she went through, she was in over her head in terms of, her clinical knowledge just wasn't there. She misdiagnosed a child. She didn't have great communication to the attending physician at the time. And therefore it led this child down a negative path in terms of outcomes for the patient. On top of that, though, she's still in fear, having some pride and fear of not wanting to go to the physician, still had this mindset that she can kind of get out of it. Like she can kind of help triage and get out of it. And she talked to the other PAs and the other colleagues in the office, but never went to the attending. And so she's telling us this story, and then she's almost tearing up about it, which, it's great. She's showing emotion, remorse, reflection. But then she talked about, most importantly, what she learned from it, which was, I talked earlier about the scope of practice. And you are in this bubble here. And when you get beyond that bubble, it is your turn to put down your pride, put down this big head you might have, even as a student, and go to someone and just run a case by them. There's no harm. There's no, the pride has got to go away. And I think that's the key to being an APP, especially, is you have to understand how to pull levers. And in that moment, that student learned right away how to pull a lever that she couldn't do at the time. And so her telling that story, getting emotional, telling about what she learned from it, most importantly, and how she would do it differently in the future. I mean, you see a student go through that, even if they're young, I'll hire that person any day. I mean, any day. It's all about that, I think.
I'm just sitting here listening to you recount that story, and wow, most maybe students that are watching this are thinking like, oh my God, what a risk to take. But like, you brought it full circle with like, yeah, it was the risk, but then she showed the emotion, and then she showed she could learn from it and what she did. And, that was probably, I'd venture to say, like, that was probably one of the best answers that, interviewee gave you during the process.
For sure.
So what's going on?
There's been 3 of those, and that was one of them I remember, for sure.
What are you thinking as she's saying that, as she's giving you that story?
Well, I think anybody who's hearing that can think back to when they were, that young in their career, or even if they're older in their career, and you have to make that decision. Do I keep going, or do I get some help, or, collaborate with others? And so at first I felt for her. I was like, gosh, I know where you're at. I've made the same mistake. So I think that's the first thing. And then secondly, again, was just so impressed with, she had like bullet points of, here's what I would do differently this time, and to not make that mistake ever again. And so when you see that, like, all in one question, you see her struggle to even answer it, get emotional, and then come back up with a great, like, here's what I'll do next time.
That's amazing.
Okay, I'll hire you.
I agree. So Keith, we were talking about kind of the questions that are laid out for you to kind of go through during an interview, by Spectrum. But I also hear you saying that you have some of your own kind of questions that you kind of like to pepper in. So what do you think is your toughest question that you ask during a new grad interview?
I think it's the one I shared already, which is the failure question, is probably the toughest. I will say, though, just for your audience, we don't do this at Spectrum, but I do know in my leadership circles, there's a lot of institutions who are going to clinical-based question. Like they'll give you a scenario, like, 52-year-old comes in with chest pain and belly pain, and what do you do, right? It's those type of competency type questions. From my reading and my understanding, it's not that they're looking for like the perfect answer. They're looking again as to your decision-making process. Even if you get it wrong, especially as a new grad, you get it wrong, what was that process like? And so I think for your audience out there, they're probably going to want to start researching this. Now, this is new. I've not heard of this until the last 6 months, but I do know it's happening. We have not gone down that road. I don't know that we will. I think there's a time for competency-based questions. I do know, that's not a question that we have like in our book of questions essentially, but I do know, depending on the service line, they do like to ask, questions like that. Maybe not in a formal presentation, but as they're like walking with somebody doing rounds, hey, what would you do if you got X, Y, and Z? And so I think there's some of that going on, but I think your audience would probably want to start researching, how would you answer like a clinical scenario type question? Hope that makes sense.
It does. And so what are they kind of looking for step by step to know that person's kind of thinking about the scenario and able to think on their feet and bring them through a process of how they would handle that situation? Is that what I'm hearing?
Right. Absolutely.
Okay.
It's that if you could bullet point out, what would you do, right? I think it's more, that's what they're looking for. Not necessarily are you getting the diagnosis right or
but what the process is. Yep. Awesome. So let's talk a little bit more about some red flags and, things that might come up during an interview that might make you feel cautious about a candidate moving forward. And then some of the, we call green flags, things that are making you, want more. And so let's focus back on the red flags. You talked a little bit already about, someone bringing up the call and maybe they feel a little bit disgruntled about that during an interview. But what are some other red flags that come up during an interview process for you?
I think the biggest red flag is when they don't really know about the role itself. And let me go a step backwards for a second. We get the APPs, so PAs and nurse practitioners that are frequent flyers. So what they'll do, remember, we have a centralized process, right? They will pepper in, applications for every single, if we have like 25 job openings, they'll put them out for all jobs, right? Orthopedics, cardiovascular, peds. It's like, okay, which job do you want? Because it's very unclear with your actions, right? And that just shows us, desperation. So that's a red flag for my recruiting team. The recruiting team will say, hey, Keith, we got this person. Yes, she qualifies, but this is like her 50th application. And we just think she's job shopping, not really looking into the details. And from our perspective, we want somebody who wants to be in that career for life. So you start in that role, and then you progress, and then you hopefully you become a leader in that role, and then you eventually retire in that role. I mean, that's our mindset. I think, again, it's not because we're able to move jobs, as we talked about a little bit earlier. I'm not saying that we're hardened to that, but still, that is our mindset. So that's a red flag. So for everybody out there, like, think about really what you want to do. And if you don't know what you want to do, you got to have a plan. Like, you can't just kind of haphazardly just start applying for roles. Like, when I got out of school, I knew exactly what I wanted to do. And it was, I wanted to be an orthopedic PA and be a surgical dog in the OR. I mean, I loved it. And so I was applying for all orthopedic jobs that kind of met my needs. I ended up getting a job, interestingly, doing home care. And it was only because there were just no jobs out there. So I applied for the role. But get this, when I applied for the role, I told them, this is not my thing. Like, I will help you do this, but when I get my dream job, I am moving on. I was very transparent with them, which they appreciated. And I only worked for them for a month, by the way. But it was very clear from the beginning, right? What I'm going this direction. But yeah, if you need my help, I'll help you. And that's what I did.
I'm hearing that a lot from the folks I've been chatting with and having interviews with, that especially with the bigger organizations where there might be lots of different specialties open, that they're applying for all different specialties. And I'm hoping that this will be a good aha moment for people that are watching this, because you have to, again, put yourself, not maybe get out of your own headspace, but think about how that's perceived. And a lot of times, like you said, HR, they see that you've applied for, X number of jobs. And that is, of course, a red flag that comes up, because what's that person passionate about? You can't tell if they're applying for, 12 different specialties.
Right. Absolutely.
What's another red flag you could think of? You've got somebody live on the hook. They're interviewing with you. Maybe they're doing that shadow experience, or, during one of the sit downs. What are some other things that their new grads are doing that is like putting the brakes on from the team's perspective?
Yeah, I think I'm sure you've heard this answer before, but I think talking about salary early on. Now, listen, I'm someone who I believe in, you should get paid fairly, and you should always try and negotiate, but there's a time to do that. And especially when you're a new grad, like, that now is not the time. Like, quite honestly, the very first 2 years, by the way, the difference in training between a physician and an APP is 18 to 23,000 clinical hours. So just think about that for a second. 18 to 23,000 clinical hours. And what happens is we get APPs who come out now and they just like want this salary, and they have all these expectations. It's like, you have so much to learn in those first 2 years. That should be your focus. It is trying to become the best PA, APP that you can be. And that takes you building a foundation of knowledge. And so I think when someone like comes in already with, PA, with salary talk too early in the process, that's a red flag for us. Medicine, being a PA, practicing in a team-based care environment is hard. And if you're getting into this because of me, you're probably in the wrong profession, quite honestly. That's a huge red flag for me.
Yeah.
We actually we're just starting this now. And I think a lot of organizations are like almost having like new grad starting rates where there's not much negotiation. And then as you become like an APP, that's experienced, right? Then we want to reward that experience and give you that bump in pay. So salary is a big one.
That was definitely one of my questions is, can a new grad, or should a new grad try to negotiate compensation?
Yeah. So I'm going to say yes, but I'm going to say don't negotiate hard. I mean, just ask for a a change in pay if you feel that you're deserving of it, and maybe you feel like you're the top person in your school, and you maybe you have experience. Like for me, I was an athletic trainer before I went into orthopedics, right? So maybe that experience could lend you to become a very productive APP early. So maybe with those type scenarios, but get the experience. I mean, don't focus on the salary. Again, negotiate, but negotiate lightly. You don't want to put the organization off. And then when you can really negotiate is when you're experienced.
Can a new grad 2 years plus? So can a new grad, when you're saying negotiate lightly, what are some things other than salary maybe that they can negotiate on? Like maybe there's not really any CME offered, or maybe there's something that they could do in regard to time off. Are there other things that new grads can negotiate on other than salary, like a sign-on bonus?
Yeah, good question. So again, the hat here is big institution. I'm like the big brother here, right?
That's okay.
So for us, no, we are standard across the board. We set CME, set PTO. We do have things like, travel policy that if you're coming from out of state, we will help pay for some of that, right? But it's all standard. There's no negotiation in that. It really is just about negotiation of your salary for us. I'm certain, though, in some instances, maybe that not a large health system, you can probably negotiate that. But here's a tip for everybody out there. This is a classic thing that we see with our new grads. They come out of school and they're looking at their salary that we're offering, and they realize, man, it's like $5,000, $10,000 lower than I can go to independent practice and make. But what they're not realizing is all the benefits on the background, all the CME dollars, what the investment is like in terms of investing into your 401k, 403b. Those are the things that a new grad, they just don't have that financial awareness yet. I didn't, by the way. I mean, I'm right there with you guys. I made some bad mistakes when I was younger. And so we get these new grads, and they're like, oh, I'm not taking that role because I'm going to work for, Dr. Famous on 2nd Street, right? And then when we find out what their, they'll tell us what their offer is. And we're like, so do you get like CME and, PTO? And it's like nothing, no benefits, nothing. And they think that that's great. And I'm like, you have to understand
they're not doing that kind of behind the scenes calculations of all those other things. And also too, something that I find with a huge mistake that a lot of new grads fall into the trap. They go to that private practice for a couple of dollars more, and then they realize like, well, maybe they're the only show in town and there's only a couple of PAs there. Now they're working, 50, 60 hours a week. Well, now that $5,000 more divided by 60,000, you're making a lot less than you would have made with another offer that also offered all the benefits too.
Right. Absolutely right. And this is nothing against independent practice. In fact, I've worked for them, independent practices, and I love them. In fact, if you go into independent practice, you're probably gonna get even a little bit more autonomy than in a very structured institution like us or like University of Michigan Medicine. That's just the nature of it. We're more standardized with our approach. Independent practice is great. You're going to learn a lot, but you just got to know what you're getting into and think about your financial future, not just the now.
Right. Well, and that's one of the big reasons why we're even chatting today, and why we're doing this series is to enlighten and give those new graduating students, the things that they should be thinking about, so they're making the best decision for themselves as they embark on their career.
Yep.
One thing I want to back up to, because we didn't, go over it really in a practical sense, and it's kind of getting back to those red and green flags. We chatted a bunch of different things on those red flags, things not to do. But what's happening during an interview where you're really feeling excited about the person? What are some things that new grads can do during the process that make you want more and want to take a risk on them?
Yeah, so I'll give you maybe more of a personal feel to this. Like I'm looking for, this is maybe even sounds like, you know, maybe too far, but I'm looking for somebody who's actually quiet, who's humble, who's a great listener first. I think we get some candidates in and you can just tell their personality is like talk, 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 talk. And I think that you can just see it. It's a train wreck waiting to happen. You know, if we hire that person, it'll work for like a year or two and it's going to fizzle out. You want somebody who is great listener first, just a great listener and a thinker first, and then can collect themselves and respond accordingly. I will give you maybe, I know you talked about like the questions. I don't do this for my interviews, but I do it for my interviews for leadership. And that is, if you're going into leadership, I give them one question. That's it. My interview is one question. And I leave the room and I let them think about that question and I let them process what the question was that I gave them. Mm-hmm. And then I want to see their thinking behind it. Like, again, how did they kind of come up with the answer they came up with? And what that does is it allows me to understand their comprehension of the question. It's a complex question. I mean, it's not like a simple question.
Right.
Did they understand the question I was asking them? And then what was the process that they went through to come up with the answer? And then how well did they actually formalize a plan on paper? I make them write it down. And then how well did they present it to me? You know, your presentation, whether you're in leadership or a regular APP, is critical. And again, it comes back to those fundamentals of being calm, cool, collected, humble, though, that you're still learning. I think if you show the opposite, where you're just brash and talking, and man, don't ever like interrupt somebody who is asking a question or talking when you're in an interview, like that is a huge red flag.
Yeah. What are some questions, what are some great questions that strong candidate can ask during an interview?
Oh, that's a good question. I think somebody who wants to know the intimate dynamics of the team. I mean, because ultimately that's what you're going to be happy in your role if you like your team and you get along with the team. So someone who will go through an interview process and then say, hey, so what's it really like on the team? Like, what's the physician PA dynamic like? Like, is it more of a dependent role where the APPs are in a dependency role with the physicians? Is it more of a collaborative role where they're kind of seen side by side? When somebody's thinking about that level of detail, and by the way, new grads don't think about this yet. This is more like a mature APP who's been in practice, who knows that dynamic level is so critical. So that's always a great question to ask. Like, okay, tell me what it's really like working on the team. Like the dynamics between all the players involved, physicians, APPs, nurses, medical assistants. What is that like? That's a great question for someone to ask.
I love that. That's really awesome. So we've chatted about a whole bunch of different things. We've gotten those new grads, their resume, they're through the interview process. We talk about some pitfalls and good things, compensation. So now you've selected a candidate to hire. They've made it through the credentialing process. They're all excited. They arrive at your doorstep that first day. Talk to me about those first couple of weeks or a month or so, kind of that honeymoon phase. What's your advice on what they shouldn't be doing? And then we'll talk about what they can do to really make a great impression and get their career started right.
Yep. So there is one more. I'm going to answer your question. I'm going to go back a question because it all relates.
Yeah, good.
The second question that you need to ask, which relates to this question you just asked me, is, do you guys have a mentorship program, a robust onboarding program? I think nowadays, if institutions don't have this, they are way behind the eight ball. We have a mentorship program that we built, gosh, it's been 8-10 years ago. And the goal is every single APP will be mentored in their first 2 years. If you're a new grad, the first year of an experienced APP, so that you know where everything is, you know how to present cases to your physicians and colleagues, what standards around what your your clinical kind of backup is. So Hippocrates or up to date, or if you do orthopedics like Wheeless or orthopedics, there are certain things that we should have standards on, and we don't want people like going on Google and getting some bad information, right? So it's making sure that the system or the practice that you have is going to be there for you in those critical early years, whether you're experienced or new. So that's another question that you should ask. Okay, now getting back to your question, I talked about to you the difference in training of a physician versus an APP, right? Mm-hmm. So this mentorship program, it takes them through everything from what tools you should have in your toolbox, to like some credentialing things that we have to go through, whether it's like an FPPE or an OPPE. And then there's checklists essentially built out like at 3 months and 6 months, 1 year, and then I think that the last one is like a year later. So we really have a pretty strong program that's really designed to kind of walk people through what it's like. Now, is it perfect? No. Do we still have issues because we're such a large system? We have physicians and APPs and nurses, and some of those programs all intersect and some don't. During the pandemic, all of it kind of got lost because we were just so busy doing other things. But it really is critical for us that we have that in place.
So it sounds like you guys really have a robust kind of framework and outline on expectations and what those APPs, kind of what they should be on track on when they first start.
We do. I will be honest, though, I think that we still have room for improvement. I think this is actually one of the things that health systems struggle with, and it's because we're all so busy just running the business day to day, and sometimes we lose track, or we think that practice who hired the APP is going to have time for that, and they really don't have time for that. And so sometimes APPs who are new will feel lost. So I don't want to say that we're like perfect, but I think that we're on the right track with our mentorship program.
So Keith, you gave us some really great insight as to how a really large organization like Spectrum handles that onboarding process and the mentoring and the different kind of checklists and things that they already have pre-set up that they have to kind of manage through to be successful. But let's talk a little bit about like the nitty gritty. So you start your role, you're a PA, maybe you're on a floor. What are some of the things that you're seeing that PAs may be engaging in conversations or actions? What should they not be doing when they start their careers?
Yeah, I think the best way to answer that is really it's this. It's you've got to ask questions. I know that sounds maybe dumb, but the APPs that get in trouble are the ones that they come in and they think they know it, or they think that they got this, maybe because they were strong in it on a test somewhere. One of the greatest lessons I think I ever learned was from a psychiatrist I worked with, and he was seasoned psychiatrist, almost like really an expert in his field. And I'm working with this guy and he has all this experience, and yet he was asking me questions. His mind was always asking questions, getting feedback, trying to understand how we can treat these patients better. Now he's asking me, a PA, and I had like 10 years of experience at the time, but still, like he's like way up here compared to me. But it just showed me you have to always have an inquisitive mind, and I think that is true at the beginning. I think even in my career, one of the biggest mistakes was not asking enough questions. even for things that I thought I knew,
Mm-hmm.
but I should have still been asking questions just to make sure this is the way our team treats a certain patient this way, or there's no new research or literature. So I think, if you're a new grad, you should be wanting to ask like 10 questions a day. Like make that a goal. Even things that you think ask the first 2 years, because you're going to get grace the first 2 years. Maybe as a seasoned veteran, you won't get that much grace. We have to just go see patients, but especially in those first 2 years, ask questions and then continue that mindset, that learning mindset throughout your career. And I think that particular physician I worked with taught me that he was still asking questions, even of me, just to get my thoughts and perspective. It's that learning mindset, inquisitive mindset you have to have.
So what is it actually? I love that answer, and I think it's spot on. So what does it look like for the APP that starts and comes in and is not asking those questions, and maybe everyone's feeling they're coming in knowing it all? What does it actually look like? What are they doing or saying?
Usually they're being very quiet. Yeah, no, I know exactly. They're usually being very quiet. Not asking those questions, not collaborating with the team. And then what happens is it's almost like you can see them start to go rogue, where they just, maybe it's not that they either don't feel clinically competent or they're not great socially. They don't know how to ask questions, right? And they start going in this direction. And then what happens is we will find poor outcomes on the back end of it.
But what is rogue? What does that actually look like? What are they doing? What are they saying?
They start making decisions, or should I say, the decisions they are making are really not best clinical practice. That they're making these decisions that just aren't right. They're just fundamentally, they're wrong. They're missing like a diagnosis, or they're missing a dosage. It's those fundamental questions that you can get when you're working in a great team-based care environment. To put this in perspective, I sit on a lot of med exec committees, not just at Spectrum, but in other organizations I've worked for. And I think there's a theme that I have really thought about a lot, and that is providers get in trouble when they are making decisions solo, when they're by them, when they're so you think about like a provider who is like in the regions, who's on their own, right? They have no providers that are interacting with them. Inherently, there are checks and balances that occur when a patient sees multiple providers, right? Maybe the provider missed something, right? Then there's dialogue about it, right? When you get somebody who is kind of on their own, let's say they're in an office by themselves, that's when I get concerned about poor outcomes that may occur. And again, I'm just telling you from my experience, I don't think I handled that well in the beginning. I think my pride got in the way of, I need to ask questions. It wasn't until I met with that, or I worked with that particular psychiatrist. And again, this is I'm 8 years into my career, and I just learned from him that no, that's actually the fun of medicine, is actually to debate and have dialogue about what we should do in this particular case. So again, critical for any new grad to just understand that. And even if you're experienced coming into a new system, our mentorship program was built because of an experienced person who came into our system, high accolades on the resume, right? But this particular APP was not presenting the cases in the proper way of what the physicians expected. Mm-hmm. And that led this team-based care dynamic down a bad path, and she ended up leaving the role. I don't even know if she practiced anymore. I mean, it was that traumatizing. It was at that point when we saw that we said, okay, we've got to have a mentorship program in place to put these, how should you talk to a physician? How should you ask a question? Should you put it more in an SBAR format, or we say SBAR. SBAR is situation, background, assessment, recommendation. But SOAP note, whatever you want to call it. Is that what you want? Or can you just ask your providers, hey, what would you do for a hypertensive who has diabetes and is 54 years old? Right. But for this particular practice, she wasn't asking the questions in the right way for them. They wanted it more in an official, kind of medical student resident type which is fine. We just have to have this dialogue before we get moving, right? We get working.
Right, right.
So,
I'm hearing you talk about collaboration and being afraid of that provider that's maybe kind of isolating in their office. And you talk about the fun of like the back and forth and kind of figuring out things together. What came to mind for me right away was, these new grads that are just starting out, like they're probably afraid of judgment, right?
for sure.
So how do you handle that as a new grad? Like, I don't want to be judged. Like, are they going to think I'm dumb? Are they going to question why they hired me?
Yeah, I think you're right. That is absolutely the fear of asking those questions. So, and I probably should have said this. When I say ask questions, when I say ask questions, what I'm talking about is not just blindly asking like 10 questions a day, like I said, but it's asking questions, but then doing a little bit of research beforehand so that you can have some of that dialogue, right? And then it's not that you're dumb, or it's that you're having a dialogue about it. And again, I think when you're a new grad, you get that grace period. If somebody is bringing you on and they're not going to give you that grace period, then that's not a right fit for anybody. Like APPs, again, the difference in training is significant. And so you have to kind of put your pride down in those first 2 years. They don't talk about this in school, by the way.
Right.
But it's just a big lesson I think I learned early on.
Absolutely. And that's, again, why we're chatting today and why we hope this series is invaluable for the students that are going to be watching it. I have one last question for you, and it wasn't maybe on some of the things that we had chatted about, but I'm curious as to how you might answer this. So pretend that I am a genie and I can grant a wish for you. And that wish is to bring you back to the beginning, the very, very beginning of your journey as a physician assistant. What is the advice, knowing what you know now, what advice would you give to your new grad self, if you could?
Oh, man. What advice would I give to myself?
Knowing what you know now after all these amazing years of experience.
Yeah, it's probably going to sound similar to what I've said, but maybe I'll break it into a broader level. Like when you are a new grad, you think you passed a test and you're certified, and quite frankly, that doesn't mean anything. I mean, I'm all for certification. There's a certain standard you have to have, right? But ultimately, it doesn't mean a thing. People can pass tests, but when you get out in clinical practice, it's completely different. I mean, there's a reason why you hear these stories of someone who was brilliant in school, right? They're top of the right, and they get out in practice and they just flounder, right? And it goes back to that mindset that you are nothing in the beginning, and remember that. Not that I thought I was like anything, but I had this experience in orthopedics. I was an athletic trainer. I could do, and ortho is different because it's a very nuanced specialty where you have to learn all these kind of special tests and these physical things that you got to do, and you can't get experience unless you do it over and over and over again. I had that experience. So I think that just not asking questions, even on things I was sure about, I think was my biggest mistake. Because I just had this, like, it's weak, right? I'm this athletic trainer and I have all this experience, right? I'll give you an example. Maybe it will help. I was working my first job. It was a knee. I worked on just knees. We just did knees. Mm-hmm. And lo and behold, like all my projects as an athletic trainer was around the knee. So it was very enticing for me. We were doing things that you just don't do with knees, very complex surgeries. Like if you have a complex knee problem, you were being sent to us. This is before my time at my other organizations, before my time at Spectrum. It was a private practice. In any case, this patient came into me, and he came into me for a second opinion. And he had an ACL tear and like I think ACL, MCL, meniscus, just his knee was torn up. He was referred to us and it was a second opinion. And so in school, they don't do a great job. If you go into a subspecialty like that, they don't do a great job of teaching you like MRIs and complex x-rays, right? So here I am, I have the second opinion. And so I do my due diligence. I'm doing research on like how to really read an MRI, especially when it's a re-tear of an ACL, because I know MRI artifact is there and that sort of thing. Thought I had it figured out just by reading, right? I did not have it figured out. So I walk into the room, and have you ever read an MRI on a patient, especially on a repeat, it can have some artifact in there. But the bottom line is the ACL looks like a fan, and the PCL is a very dark black line. Mm-hmm. In my readings, I must have gotten mixed up on which was which. And so the patient was like, yeah, I'm just here for a second opinion, and I'm examining his knee. And it was complex because his knee, this is like a second ACL tear, and he had a lot of scarring in there. So when I'm feeling his knee on what's called Lachman's test or anterior drawer, it is not moving. It doesn't feel like a normal ACL tear. So I'm putting that together, and I'm looking at his MRI, and I'm seeing what I thought was the ACL, and it wasn't the ACL. It was the PCL. And I said to him, your ACL is fine. I don't see a tear here, right? And, he was like taken back by it. And so after that fact, afterward, because I saw his like face was just like, after that fact is when I went to my fellow PA colleague who had much more years of experience. And I said, look, I'm looking at this MRI, and I'm kind of pointing out like everything that I read about it. And all it could have taken is just one conversation I would have had before that patient. And it could have been solved right then. And instead, my pride, thought I knew it all, did a little bit of reading and thought, and so the order in which I did that was wrong. I should have done that prior to, especially because it was a very complex, because again, the previous history of trauma and what an MRI looks like in that knee is very different than what you read about, right? So again, just that's just one lesson that I'm not afraid to share it. I did that patient wrong that day because my pride got in the way, and I learned from it, and I didn't do it again. I was very talkative afterwards, of course. Mm. Hope that helps.
That's really, I don't want to say I love that story because, but I love what you learned from it. And I think it's a great message to our viewers out there about, not letting your pride get in the way and asking questions and engaging other providers. I mean, they're new, right? To act like you're not new, like that doesn't make sense. But I think sometimes you forget that. So what I hope folks that are watching will keep doing is thinking about that and thinking about things from the other perspective, how they're perceived, and utilizing you gave such amazing advice today. And I really appreciate it. And I think it's going to be tremendously valuable to the students that are watching.
Oh, absolutely. And if I can just say one more thing, I just thought about it as you were talking. The whole, because you asked me the question earlier about, are they going to think that you're dumb for asking that question, right? I do think at the time, so we're talking like back in 2006-ish timeframe, when I was a new grad coming out. At the time, the notion of an APP coming out of school and just going, just like, okay, you're certified, you're going to go see 30 patients a day, go. That was very common back then, right? I think the awareness now of the difference in training has really come out, where we can utilize APPs, of course, like they are such a great asset to have for any practice or organization, but there's a right and a wrong way to do it. And I think before, the expectation was, Keith, you run, you have all this experience, go. And that was the expectation. I think nowadays, getting back to your question, nowadays people should know that you can't do that. You can't just have new grads run anymore. There's got to be some time built. That's why it's such an important topic to make sure they have some kind of mentorship, some kind of onboarding in place.
Agree. Absolutely. All right. Thank you so much again, Keith. It was great chatting with you, and I appreciate you taking time out of your day to chat with us today.
Absolutely.
Thank you.
Thanks for having me.